Allora, dottor Riccardo Forte, ti presenti?
Mr. Riccardo Forte.
Sì, Riccardo Forte, sono lo stesso di prima. Allora, abbiamo una pancina da trattare. Ora, come spesso capita in queste situazioni, l'indicazione non è proprio
We have this
la più
tummy to
eclatante,
treat.
perché lei ha
The indication
un buon tono.
is she's got a good tone. She has a light accumulation of fat. But often we have these patients who, notwithstanding the exercise and the food, are not satisfied with these finishing touches where there is mobility of the it is not ptosis, but we can talk about a reduced retention of subcutaneous septums and the little accumulation, a build-up of fat, just a couple of centimeters. So we will treat this area. We can treat this little bulging, even though it is not a real bulging. It's not a sagging skin, but we can try to reduce it. We will treat this area. So we can enter through these two accesses, here and here. So with two little holes, we can remove the excess fat here and crisscross. Is it quite clear? Yes, we can hear you, we can see you very well. If there are questions from the audience, I will forward the questions to you.
Ci sono domande sulle indicazioni?
Are there any questions so far? So there's a moderate fat bulging. This is the ideal situation for a treatment of laser lipolysis. We are not seeing you. We can hear you, but don't see you. As you were saying, Robbie, it's an ideal situation where the suction of the melted fat is superfluous. In this case, we work on the skin tightening and moderately on the lipolysis, because as I said, the thickness is not high, but there should be a better adhesion of the Q to the facial part. So we will see the setup of the parameters. It's halfway between a facial treatment and a body treatment, since there's no need to have a strong lipolysis. I will use a 300 microns fiber, and we can start. So let's see the screen of the laser. This is the home page. When you start the laser, you select treatments. You can see an array of treatments you can use. And we choose Endolift. As we said, Endolift is one of the applications of this machine. In case we want to have a laser lipolysis, we will select lipolyzer. In this case, we select Endolift. There are preset levels. So by default, there are settings that are okay for the starters, for the beginners. You can select the area, so lower eyelids, cheeks, mandibular edge, under chin or neck. But with the indication that we gave this morning and the guidelines, we can select custom, and the laser asks us to select the power, the watts. So we click here, and we can increase like let's see with 2.5 if the patient has problems with this. It is quite a low voltage, and then we go to pulse. Again, we've got this screen. We have a lipolysis, which is moderate. We have a skin tightening. I would select 40 milliseconds, and I would reduce the T-off to 50. And we go for ready. Now we have the settings. The screen sums up the setting, 2.5 watts, 40 T on, 50 T off. It is a very prudential setting. But the patient is anxious. Also seeing the situation, let's talk about the fiber. It is a sealed fiber. It is sterile, 300. Focused. I wear the sterile gloves while my assistant disinfects the area. If you want me to explain something better, just ask me, because I could take some things for granted. So let me know if there are details you want me to further explain. So, talking about the fiber again, are there any questions from the audience so far? No, perfect. In this case, we use a air cooling system that allows us to have an analgesic action and to control the temperature. I'm going to show you the fiber. You see how it is assembled on this support. You take the fiber and I do an integrity test. I roll it around the fingers like this, and we can assess if there are discontinuities or the external coating is broken. So things that could create a breakage while we are doing the treatment. So I unlock the tip of the fiber, I screw it here, and now you can see whether there are breakage points here. In this case you would see points of light, but in this case there are no light points. Another test you can do. Do you remember the picture that we've seen before during the presentation where you saw that sort of flame coming out of the fiber? It is exactly what I'm reproducing here on my glove. This is a test that you can perform during the treatment. If you see this clear and neat delineation of the beam of the laser, it means that there are no irregularities or carbonization. If you see a diverging beam or a beam with sort of sparkles, it means that there's a diffraction on the tip. And in that case, the fiber, well, either you have to clean the fiber just with your fingertips, you can clean it, or you replace it. In this case, as you can see, also the transmission and the focusing is perfect.
Ok. Allora, aspetti. Abbiamo detto questa è la nostra zona da trattare, qui più o meno il punto.
This is the access point.
Aspetta che non vediamo.
Vediamo se riesco.
Ecco, da questa posizione qui è perfetta,
recuperare.
grazie.
Mi spinge il pedale verso di me, per favore? Che...
Si è spostato col cavalletto per stare più centrati.
Ok. Allora, sollevo un pochino una piccola plica.
So I take a fold with a couple of laser points. The fiber goes in. So my assistant now keeps tight and
Fare un po' di
stretched
zoom out, magari, così vediamo
the
da
skin.
grazie.
A questo punto vedete che la fibra
You see that the fiber makes its own way. I operate this back and forth movement. So I work both on the more tilted septums and on more straight ones, and then the speed depends on the resistance of the tissue. At the beginning, there's more resistance, of course, and then little by little, the fiber goes in more smoothly. The other parameter that has an impact on the speed of treatment is the feeling of pain. The quicker I go, the less pain will be felt by the patient. If I slow down, the contact between the tip and the tissue increases, so the temperature will increase. Can you confirm that you're not using any anesthesia, just air cooling? Yes. As you can see, and as my colleague Dinko said before, the left hand guides the fiber, maintaining it at constant thickness, and we can control the thickness with the intensity of the light. You see, if I go more on the surface, the light increases. On the contrary, if I go more deep, it tends to disappear. So the intensity of the light and the brightness of the light gives us a perfect idea of the deepness we are working at. So there's a question. So the pulse is steady, back and forth, or only when you retract? It's a continuous forward and backwards. Again, I see that the patient is doing well, so the pedal is continually pressed. If I have a signal of pain, I will pause a little bit, and this will ease the pain. The moments when the fiber is more effective is when the fiber stops and goes a little bit forward again. So I repeat with the fiber, I am inside, I retract, I stop, and I go forward, so stop forward. These are the moments of best effectiveness because the action I have is prolonged in that specific point, so there's a coagulation. So I'm melting with quicker passages, quicker movements. You see here there's some resistance. You can try to insist with the fiber with small pulses.
If you hear, you can feel the. You can hear? Not now?
Un addome, se la cute è un pochino più tesa.
If the skin is tight, is stretched, can you increase the volume of the laser, please?
Sentiamo anche noi quando eroghi e quando no.
Ok, allora, stand by, back. È sufficiente il volume del laser?
Just the laser volume?
Sì, va bene.
Ok. Devo rifare tutto il settaggio.
I have to restart the setup. 2.5, pulse, T on, T off.
T off 50.
Poi come vedi sotto...
Avevamo fatto 200 già.
So 200 joules.
Lo sentite?
Can you hear it now? Yes, thank you. I don't know if you can feel that the fiber now goes in a smoother way. There's less resistance, less friction compared to the first times when there was more friction. It means that here we started to have melted fat. Yes, we can definitely see it. The places that are more painful are the places where the fiber tends to get stuck. And it's probably perforators which are very sensitive to laser stimulation. So I suggest not to insist. So I can already feel a reduction of the fat bed. I don't know if you can see the difference in thickness. But I feel a different consistency. Here it slips away, and here the consistency is different. Here, you see, tends to slip between my fingers, and here it's more solid. So for sure, here there's a good quantity of fat, which is melted, coagulated. How many joules? 200 plus 57 now, 257. For such a little tummy, I would not exceed 300, 400 joules per side. Since there's not much volume, there's no laxity, it's even difficult to make you understand what I'm feeling. It's a very tactile perception. The consistency changes. You can pinch the skin and pass the fiber between your fingers. So here, apart from the fact that it can be a little painful for a patient, you really feel the thickness and how this fold is less compact. I can feel very well the difference in thickness now. So, again, if you remember the image of the red light, when you touch and you can feel a macroscopic difference, that's already a good endpoint. What we can see now is trying to go a little bit more on the surface. A trick is to create this fold and have the fiber go against the derma from the inside. So in this way, you really stimulate the derma in a very effective way. With a series of movements like this, you will be able to improve the stimulation. Here there's a small adherence. Let's see if we can get rid of it. When the patients ask us, what's the end point? So one can imagine the joules, the quantity of joules emitted. So that can be a point that allows us to compare the result with the other side of the body to treat. So if on one side I use 300, 400 joules, on the other side, most probably, if it's the same, I should use the same quantity of joules. If there's a difference, I can increase or decrease, like for a liposuction. But the real endpoints for the survey that we carried out and published last year, for the 10 most experienced Italian doctors when treating the face, I know now we are talking about a body, but the three main endpoints were change the consistency, compactness of the tissue and the shape, and the third was how many joules are you working at. At the second endpoint, there's some redness appearing. It means that the temperature is increasing. The stimulation has exceeded the limit, so we should stop probably. Can you see the difference? In terms of thickness? I feel the tissue slipping under my fingers. This tissue is more compact. The edema, of course, is present. I would say that it's already a good situation. We've emitted 460 joules, a good target, considering that this area is like 8 by 8, 60, 70 square centimeters. It's not a liposuction. It cannot be. So we feel the texture of the skin changing.
Sì, chiedevo... C'è una domanda in sala, Riccardo? Un attimo.
No, uguale.
Riccardo? Chiedevo...
So I have a question. If we wanted to increase the quantity of joules, so you stop like 450, we could have gone till 600, for example, and the tightening would have been greater or not? Did you hear the question? No. So again, you stopped at 450 joules. The third on the left side. If you wanted to go to 600 or 700, would have you expected a higher tightening, a greater tightening? Yes, well, not directly proportional. I think that from this level on, this moment on, each 10% of result more, you need 50% of work more. So from the first visible result, from the first palpable result, the curve, the ratio between what you do and the clinical benefit is unbalanced. So you work more and you have less improvement. So the answer is yes. With greater laxity and more fat, I would have probably gone further. If it were a mine patient, I would have done 2 soft sessions so that after the first session we could have corrected a little bit on the second one. Looks like a paradox. So on such a minimal situation, I can offer 2 sessions, but usually patients start with this situation. They are highly demanding because 30-40% of the result is felt like a failure because she would like to cancel, get rid of the problem. So in order to have a more focused performance and give the best satisfaction to the customer, I would say that a couple of sessions, 4 months apart, would allow me to give her the best possible result. What do you say? I agree. Riccardo, you talk about a soft treatment with the same parameters. This has more increased joules. I will go to 800. So if there's fat, 1000 joules can be emitted here. Not in this case. The treatment of 800 joules is okay for her, but it's considered a moderate treatment on the body. It also depends on the expectation of the patient. If she's okay with an improvement or a firmer skin, of a visible reduction but not complete, 1 session can be enough. But hardly someone who comes with this situation will be satisfied with the first step. Usually they want to have the final perfect result. That's why I suggest 2 sessions. The first one to understand the sensitivity of the patient, and the second one to perfect the result. As we said, 3 months. 4 months in this case. There's another question. Riccardo, when you have laxity or stretch marks, can you hear the question? Yes, not very well. So people who have laxity of the skin or stretch marks or after birth tummies with stretch marks, what do you do in this case? Several sessions, or you increase the effluence, or you increase the T-on in order to have more traction on the unelastic skin or stretch marks. What do you do? Can you present a simple case, please? It's always you, Chiara. You owe me one. Well, you always ask about the difficult conditions. You have very stressed septums. The skin has undergone stresses of compression and dilation, so the response is lags and slows. The patient knows the constraints. The treatment will be limited, so I try to prepare the way with injectables to stimulate the metabolism of the skin. I try to use focused ultrasounds plus Endolift, improving the performance on skin tightening more than lipolysis, and I fix at least 2 sessions in those situations. But as I said, it's like a mission impossible, where often the surgical indication can give, well, Endolift can give results, but the patient must be aware. If the patient is aware that she's not undergoing a surgery and that the results will be better than any other medical treatment that would give 0 results, she'll be a happy and rewarded patient. If she thinks she will get the same results of a surgery, you'd better not treat her. Thank you.
Poi Roby, non so se vuoi aggiungere
Roberto, I don't know if you want to add anything. No, it's very clear. I have to say that in spite of seeing pictures of patients with surgical indications, the patient who comes often to us is one like this. She has no surgical indication. They look for non-invasive but useful methods. I have a lot of males who come to me asking whether they can have a six-pack with this procedure. A lot of times we see that the muscles are actually designed, so they ask me to follow the abdominal lines to sculpt. It's a mission impossible kind of thing. But often these are patients who are already in a good shape, but they want to be better and feel better. A general question. You presented a few guidelines. T-off is always 50. So you never touch it? Or are there any conditions, No, I hardly ever touch it. If I raise the intensity or prolong the T-on, I am a bit quicker because moving and emitting in a linear way, you never stop, So T-off makes more sense in a concept of static emission. When I move, actually, Dinko is right when he says that he uses continuous emissions. If your hand is nice and you're skilled, well, why not? It becomes less handy, though, and the results are nice, but you have to be skilled. T-on and T-off must be contextualized depending on the area. On the lower eyelid, as we will see later, the T-on and T-off will be different, I believe, yes. Well, maybe T-off, not so much, but T-on definitely. T-off will be still be 75, but you will see the differences in sending the pulses when I did them with the pedal. We see that the patient doesn't feel any pain. It's obviously due to you, but also to cryo. So can you please tell us when to use it? Well, use it when you have it. If you have it in your outpatient, why not? A few patients do not like it, though, mostly on the face. Sometimes patients don't like it on the neck. They believe that this may lead to a side effect. On the abdomen or the body, you can use 5, 6. Also clothes, you can see a little bit of frosty hair here. A lower flux or flow on the face, because otherwise the patient will feel like their face are being frozen. Like neuropraxy effect, which is very unpleasant. I keep it distant. I keep it around 2, so very light. On the face, if the patient is really sensitive, instead of using cryo, I prefer to use a bit of anesthesia. As I said before, we have treated over 1,000 patients, but we use anesthesia only on 50 roughly, so very low percentages. In which areas, mostly, out of those 50 patients? The face. I am talking about Endolift. Endolift face. Endolift body as laser lipolysis, well, that's always with anesthesia. Barcodes, I rarely do it. So now I wanted to tell you, I can clearly perceive the symmetry. You remember the fat pad? Look at the difference now. You see more stability, a reduction of the volumes. Erythema is just mild. this area was all red and it's already going away, this is the right type of erythema, not the one with the yellow light. I don't know if you can see the contraction of the projected area towards the center. So you can already see the lightening of the width. I would say that we use 400 on this side, maybe another 50, and we're done. One question: if we use new radio ones, 300, 400, is it the same? You always use the same entry point? Yes. With maximum 400. Over 400, I do it differently, but it's with anesthesia, so I use the same entry point that I use for the microcannula. It's a bit easier. Barcode, I still had something to say. If there is a specific request or the patient may really benefit from it, I do it and I put it forth. Rarely though, because unfortunately paresthetic manifestations on the lip in terms of anesthesia are way more frequent and patients suffer from them or due to them a lot. If there is no good indication of no specific request, I wouldn't venture into this area. You generally use HIFU in the face. What percentage with Endolift? Question number 2. Do you use radio frequency at all with microneedles or transdermal one with Endolift? HIFU, when the skin and the neck are really saggy, well, I would say so. Yes, I would use it, but the costs are way higher for the patient. When we find a certain balance in terms of costs which are driven up, and the patients understand the benefit in fatty areas, I would say so. But like this little tummy, you know, Endolift is absolutely enough on its own. With a little bit of sagging in the neck or fatty neck, well, it's not necessary. It helps us if the indication is more difficult. A heavy neck with the more remarkable neck skin sagging in the neck. For the first 2 years, we never utilized HIFU with Endolift. We only started a year ago when Roberto put it forth. And I have to say that it does make a difference in some situations. So Endolift first and ultrasound. They're well tolerated. The downtime doesn't change. Skin tightening, yes, we see an improvement in critical situations. Radiofrequency. We use transdermal with needles. We don't do it contextually. We have never done it, not because we can't, but just because we never had a chance. For some patients, if a lot of fat was melted, we use radiofrequency. That functions in this case as well. It works on fat pads to eliminate the tightening of the tissues post-laser lipolysis. So radiofrequency maybe after 15 days if you want. Can you please ask the patient to comment? Yeah, I will have to bring her back to life first. How was it? She had a little bit of muscular contractions a couple of times because you get closer to the fascia, or maybe when we go towards the pelvis or around this area here, but she had a few contractions. But yeah, you're also doing it with no anesthesia. Remember that this is a surgical device. It's not a cosmetic one. This is real surgical laser lipolysis. It can be milder, it's medicalized, but fair enough. This is microsurgery of the fat with optic fiber. No anesthesia. Well, it's not to be taken for granted, not even locally. So 751 joule in total, plus 200 in the first setup. So 460, 70 per side, roughly. I would say that 1,000 joule is enough. Seeing her condition is not that compromised. Otherwise, we could have gone up to 1,500, 1,800, maybe 2,000, but that's not her case.